Re-examination of the former Life Esidimeni Managing Director, Dr. Morgan Mkhatshwa, continues. He denies that any of the patients who were discharged from his facilities during the Marathon project left without reports of their medical history. This after lawyers representing the NGOs that the mental health care users were transferred to told the court that some patients arrived with minimal information without their medication nor their clothes. SABC News reporter Chriselda Lewis joins me live in studio. Thanks very much for joining us, Chriselda. So what more do we know now?
Well, Nompu, lawyers representing some of the NGOs argue that there were a staggering number of patients who arrived at their facilities from Life Esidimeni without a discharge summary. So this would contain crucial information, including the medical history of the mental health care user. So Dr. Mkhatshwa denying this, insisting that discharge summaries were given to the patients and that he believes that was sufficient for the receiving facilities where those patients were taken to. Let's take a listen.
There was reference by a number of the cross-examiners to alleged failures on the part of Life Esidimeni to have provided patients with what was broadly referred to as records without what was meant with records, and also a failure to have provided medication, which you disputed. Do you recall that?
Yes, I do, my lady.
Now, would it be correct that Life Esidimeni operations were governed inter alia by the Mental Health Care Act, number 17 of 2002?
That is true, yes.
Doctor, are you aware of any provision in the Mental Health Care Act that a patient's entire file must be provided to the receiving facility or receiving person on discharge or transfer of a patient?
Not to my knowledge, my lady.
Well, Dr. Mkhatshwa also maintains, Nompu, that he was unhappy about how the process to transfer the patients was being conducted and how they had somewhat been kept in the dark. Let's take a listen.
We also did not have full information on the process as such. And also, it would have helped us and the Department of Health in managing the process much more effectively. It also indicates the fact why Life Esidimeni was totally against the time period that was offered and needed a more extended time to make it the process as practical as possible, and make sure that we all had the necessary data and information about the NGOs that we were going to discharge these mental health care users to.
So re-examination will continue for about an hour after lunchtime, Nompu, and a bit later on today, we're also expecting the former head nurse at the Life Esidimeni Waverley Care Centre to take the stand. She's the next witness.
Thanks very much, Chriselda. Chriselda Lewis is our senior reporter here at SABC.